The 6th Annual Digital Health Hub Foundation Awards seeks to find the most impactful and disruptive digital health companies. Out of 1,500 submissions, only a select few have become quarter-finalists. Let's learn what their superpower is.
FloPatch is the world's first wireless wearable point-of-care Doppler ultrasound system. This novel device provides dynamic assessments that quickly and non-invasively determines a patient's response to IV fluids. Critically ill patients often present with signs and symptoms of low blood flow and are administered IV fluids to increase stroke volume. However, in as many as 50% of these patients, IV fluids may be contraindicated and can even result in adverse events such as pulmonary edema and kidney injury. Knowing when IV fluids are ineffective can reduce the risk of immediate or downstream fluid overload. FloPatch adheres to the neck and assesses the carotid artery Doppler pulse. Since changes in carotid Doppler reflect changes in stroke volume, FloPatch gives clinicians a window into the left ventricle and helps determine whether IV fluids will have the desired effect. FloPatch's compact, user-friendly design helps clinicians make more objective decisions about fluid administration early and often throughout the continuum of care, especially in patients with sepsis and septic shock.
Now, hear in their own words why they should win.
Hi, I'm Dr. John Milkenny. I'm the co-founder and chief medical officer of Flosonics Medical. Our solution at Flosonics is a wireless wearable Doppler ultrasound that connects to an iOS device and is a really elegant way of looking at the right and the left side of the heart simultaneously through a major artery and vein. And what this does is it helps clinicians, physicians, nurses guide fluid resuscitation in sepsis and septic shock. Our superpower at Flosonics is definitely our people. It's the engineers who are building first of its kind, one of a kind hardware, software, and the clinicians who bring it to the bedside and teach physicians and nurses in the field how to use our device to help resuscitate patients with sepsis and septic shock. I think that we should win because as a company, we've grown tremendously and we have now been used on over 2,000 patients. We have received anecdotes from physicians and nurses across the country saying that our device has helped prevent fluids from being given when they didn't need to be given, and have also encouraged fluids to be given when patients were able to tolerate and handle more intravenous fluids, which is improving resuscitation of sepsis and septic shock at these different institutions. Furthermore, we have recently been cleared as a device to be used on all different arteries, so there are additional avenues of clinical research and interest that could open our device for other outpatient indications, and we're really excited to study that and bring that to clinical fruition.
Follow their journey as they strive to become a finalist against a very strong field. Join us October 21st for our grand finale at HLTH in Las Vegas to witness the winners crowned.